Hello, Dr. Jeffrey Tokazewski. We're here to talk about this wonderful new program that we are going to be piloting with Penn Medicine, WURD and Penn Medicine. And it's really to raise awareness to our community about this, this free service that's available to anyone who has Medicare. And there's a free Medicare Annual Wellness Visit that anyone who's over 65 is eligible for. So you are a physician with Penn Medicine.
Yes.
Tell us a little bit about yourself and why this program is important.
Sure. Yeah, my name is Jeff Tokazewski, and I'm a family physician with Penn Medicine. I worked for Penn Medicine for about 16 years, and I have a variety of different interests, but one of my interests is to get awareness out there about this annual wellness visit. So this visit's been around for quite some time, but many patients don't know that it exists, and many providers don't really emphasize or take advantage of this visit. As you mentioned, it's a completely free visit. So if you have Medicare, or if you have what we call a Medicare Advantage program, where you might have Medicare that is sponsored by another company like Aetna or Independence Blue Cross or Horizon, this is a free visit where you can go and meet with your primary care provider, and you don't have to pay a copay, and you don't have to pay out of your deductible. Many patients who have Medicare have a large deductible of $130, $140 that they have to meet before they can see their provider. This visit is exempt from that deductible. So part of the visit is that we want to try to take some time to talk about things that we don't normally get a chance to discuss during a visit with your doctor or a primary care provider. So if I go to my doctor, I might have a sore throat. I might need to talk to my doctor to see if I need antibiotics, or I might have high blood pressure and I might want to visit my primary care provider to have a blood pressure check. But sometimes we don't get time to talk with patients about other risk factors that may impact their health, like whether or not they exercise regularly, have they had any problems with falls, are they at risk for depression, are they having difficulty taking care of themselves and doing things that they need to do to promote their self-care. So this visit is really a great opportunity to be able to sit down with your primary care provider and talk about those important topics.
So it's really an effort to focus on prevention.
Exactly.
And,
yes.
and to be proactive around your health, because it's more of a consultation than an actual doctor's visit. Is that correct?
I think that's a good way of interpreting it, yes. It's a chance to talk about factors that may impact your health in the future rather than to talk about problems that you might have today. But these are important questions that sometimes we just don't have a chance to talk about. And so, at Penn Medicine, we would really want to try to emphasize the importance of that visit and to try to get folks to take advantage of the fact that they have a free opportunity with their primary care provider to talk about those topics.
And I guess the challenge is that a lot of times people don't, regardless of what it is, when it comes to health, a lot of times we don't become activated until there's a problem. And so this Medicare benefit that's completely free and completely available to anyone who has Medicare is really challenging people to say, you know what, I don't feel sick right this minute, but I want to be proactive around understanding how I can take better care of myself into the future.
Yeah, Sarah, I think you're absolutely right. I mean, we tend to, just by human nature, we tend to wait until something happens and wait until we don't feel well to go to visit our primary care providers. So, I think a lot of times we'll think, I should really get to see my doctor. I should really go to my nurse practitioner or my physician's assistant and just make sure everything is okay. And, this is really a great opportunity to, as you said, challenge yourself to say, you know what, let me go and see what's happening with my health. Let me see what things I should be doing differently. Let me go and get the cancer screenings that I need and be sure that I am not at risk for having a cardiovascular event like a heart attack or a stroke. So yeah, I think you put it really very succinctly in terms of what we should be doing in terms of this visit.
So before we get into the exact specifics of how you access this benefit, Talk to us a little bit about what some of the health challenges are for people who are 65 and older who fall into this category for Medicare. Are there certain health challenges that are disproportionately found in this older population?
Yeah, so as we get older, now there are plenty of patients 65 and older that are in excellent health and really have very little medical problems. But for most people, there are increased risks as we get older. So the first that I would say is that when we become 65, we are at increased risk for influenza, so the flu, and pneumonia. And at 65, you should be getting annual flu shots, and you should also be getting a series of 2 separate pneumonia vaccines to try to prevent pneumonia. Secondly, as we get older, we're at increased risk for high blood pressure. Even if your weight is normal and you eat a healthy diet, as we get older, the arteries get harder. They get less ability to expand and contract. And what ends up happening is, for many people, especially for those people that have a family history, the blood pressure can start to rise. And you might feel fine, but your blood pressure might go up. Thirdly, diabetes is a risk factor as we get older. And again, even if you have a normal weight and you eat a healthy diet, and maybe even if you don't have a family history, you may be at increased risk for developing diabetes. And so high blood pressure and diabetes in particular can lead to other problems like problems with your heart, decreased blood flow to your eyes. You can have vision problems, you can have kidney problems. There can be decreased blood flow to your extremities, so you can end up with problems where you lose sensation, or at worst even lose the ability to get blood flow to the extremity where you have to have an amputation. So there's some really severe consequences of those health problems. And lastly, as we get older, there is unfortunately an increased risk of cancers. So cancer does affect young people, as we know, but as we get older, unfortunately, cancer risk increases. So for people who are 65 and older, it's really important that they meet with their primary care provider, at least on an annual basis, to talk about some of these risks and to talk about how we can mitigate those risks.
What about things like bone density and memory loss? Because I know that some of those things are, at least in my mind, connected with getting older as well.
Yeah, sure. So you mentioned bone density scan, and I omitted that, but you're absolutely right. At 65, if you're female and you have not had a bone density scan, it's recommended to have a bone density scan at that time. There are certain people who should have a bone density scan earlier than 65, and occasionally men also should have a bone density scan depending on the medications that they take and the health problems that they've had. But a bone density scan would be recommended for women at 65 if they've not had one before. And the second issue you mentioned is memory loss. That is a really tricky problem that I found in my practice as well, is that many people will say, my memory is just not as good as it used to be, and I forget things sometimes. It's really challenging to be able to tell, is that normal aging? Is it because I don't use my memory as much as I used to when I was working, or might I have some sort of problem? So meeting with your primary care doctor or your healthcare provider can help maybe to at least get an idea of whether that memory loss is a normal age-related factor, or is there something more that's going on. So I think at least to get an idea of where you stand there, that can sort of move you forward in terms of whether or not you need to see someone else.
Excellent, excellent. One of the things that I know has been a real challenge is the kind of racial health disparities that exist, and that African Americans are oftentimes disproportionately represented in a lot of disease categories that that can be very challenging, whether you're 65 and older or not. Mm-hmm. And so I would think that this benefit could be even more, this free consultation with Medicare could be even more profound for the African American community, because there are kind of these heightened risks that can be associated with obesity or, like you said, diabetes, hypertension, things that disproportionately affect the African American community. So I don't know if you can speak to just kind of the added opportunity for African Americans to avail themselves of this benefit.
Yeah, absolutely. Unfortunately, there are a number of diseases or disease states that affect African Americans more so than, say, Caucasians. Some examples would be prostate cancer, colon cancer, diabetes, and renal disease, so having kidney failure, so to speak. And so if you're not already looking at those things, the impact can be much, much greater than if you're at increased risk than at, say, for someone who is at, we'll say, average risk. So the sort of bang for your buck in terms of this annual wellness visit, which is no bucks at all because it's a free
Right.
visit, is really even greater in the African American community.
So let's drill down exactly what someone could expect to experience if they come to one of these free annual wellness visits at Penn Medicine. How long is it, and what can they expect to get out of it?
Sure. So there is a little bit of variability depending on which provider you're seeing, because everybody has sort of their own style, and you may see this if you've been to visit a provider, that some providers have a particular style that's a little bit different, but there are some components that are the same across the board. So, first you're going to, of course, check in. You're going to meet with probably a medical assistant. They're going to check your vitals. They may check your vision and do a vision screen at that time. They're going to ask you if you're having any problems or concerns, although again, the visit's really designed toward wellness. So if you're having a problem, we encourage that you make a separate appointment so you have enough time to discuss that significant problem. But and then either the medical assistant or the provider is going to go through a lot of questions about your health, about your day-to-day life. So we're going to ask questions about how well you're able to carry on your day-to-day functions. So a number of things, like simple things that we think of simple things as eating, preparing meals, using the bathroom, and then some other questions that might be a problem for people like, are you having difficulty buying groceries? Are you having difficulty paying your bills? And so those are called activities of daily living and independent activities of daily living. And so if you're having an issue there, we can talk to you about maybe some resources that would be available to help you. We're going to ask you about whether or not you're at risk for falling or whether you've had any falls. Falls are a major, major cause of morbidity and mortality in elderly patients. And so we really want to ask people about that. We want to talk to people about depression, so we'll ask you if you've had any symptoms of depression. If you have, we'll get into it with some additional questions and follow-up questions to see how bad your depression is, and then we can talk about some resources to be able to help to treat your depression. We're going to talk to you about whether or not you exercise and how much you exercise. We're going to discuss your diet. So we're really looking at every detail of how you live your day-to-day life, so that we can find possibly risk factors that maybe we could talk about and that you could change with assistance and help to live a healthier life moving forward.
So, and you also get some type of roadmap, some type of plan of action upon leaving. Is that correct?
Yes, absolutely. Yeah. So when you leave, you're going to get sort of a roadmap or a blueprint of where you've been, what screening tests you've had, what screening tests you might be due for, and you're going to get a list of tests that we would recommend that we might order at the time of the visit, so that you can go and have those tests done, and maybe we can follow up afterward to see how you did on those tests. If you need vaccines and you're overdue for vaccines, you may receive vaccines at the visit as well. Sometimes we can't give all of the vaccines at once, so we may ask you to come back at a later date, or we may ask you to get a vaccine at another location, but we're at least going to update those immunizations. And so you're going to get also a summary of what your goals will be moving forward. So you would talk with your provider about what goals you have for your health. And these can be any goals. It can be something as simple as, I'd like to eat better. And it can be kind of ill-defined, or it can be very specific. Like I would like to walk 3 times a week for 20 minutes. And so you're going to set those goals, and you're going to see that goal on your summary sheet, on your sort of roadmap, as you mentioned. And that would be something that you can work toward. And you're also going to get a list of all the medications that you take. If you don't take any medications, that's fine, but we can update your medications during the visit so that you have a list. Very frequently what happens is I'll see a patient who comes in, it might be a new patient, and they don't really have a good handle on what medicines they take. It's so easy to get confused about your medications, especially when you've got multiple providers prescribing things. You might have a cardiologist and a gastroenterologist and somebody who manages your diabetes and your primary, and you can have this very complicated list. We have a way to provide a list for you that you can actually keep on your refrigerator or wherever it's convenient, so that you can review all of your medications very easily. And you can also take that list to your other providers so that you can say, hey, this is the list of medicines that I am taking. You should check and make sure that we're on the same page as well.
So this, again, is available to anyone who is over 65 who has Medicare or Medicare Advantage. It's a free wellness visit.
Mm-hmm.
And is that was that instituted as a part of the Affordable Care Act, or was that in place before the Affordable Care Act?
It actually precedes the Affordable Care Act.
Really? Okay.
Yeah, it does. It's
well, good. So maybe
surprising to me too.
Maybe
yes.
it will stay intact if the Affordable Care Act gets systematically dismantled, as it seems to be.
I certainly hope it stays intact, because it's a great service. I would just point out also that there are people who have Medicare who are under 65. So
okay.
People who are under 65 who are disabled often are able to receive Medicare. They're recipients of Medicare. So some of your listeners who unfortunately may be disabled, who have Medicare, they also do qualify for this visit as well.
wellness visit. Okay,
yes.
Excellent. It's the Medicare Annual Wellness Visit. It's free, completely free, no co-payment.
Correct.
No insurance requirement other than Medicare. And how people can access it through Penn Medicine is to text.
That's right.
So you're going to text the word visit, VISIT, to 622-622. Is that correct?
That's right, yes. So in terms of the person you're going to text, so when you get your phone, if you're going to...
Yes, I have my phone.
Yeah, you got your phone there. We can practice.
Do a little
yes.
show and tell.
Yes.
All right.
So
we go to the text function, and
yep,
so
we
where
go.
it says to...
Yep, so to, the person you're going to text is going to be
622. 622. Is there any
Yes.
space?
There's no space. I believe
Okay.
you can just text 622-622, and then the word you're going to text is visit, VISIT.
And then you just send it.
And then you would just click send.
All right.
And then what's going to happen is that you're going to get a text back, usually within...
Hi, thanks for texting Penn.
There you go. Yes. That's
We'll call
the text.
within 24 hours. Excellent.
That's exactly what you'll get. So you'll get a text back.
It works.
Yes, that says that we're going to give you a call. So it just confirms that you texted the right place. So if you don't get that text back from Penn Medicine, then you might want to try that again. But you'll get a call. You get the text back that says that we're going to call you. And then what will happen is a Penn Medicine coordinator will contact you, and we'll arrange for a visit. And at Penn Medicine, we have a number of practices throughout the Philadelphia area. We have practices in South Philly, the Northeast, West Philadelphia, practices in the suburbs, north and west of the city, and in Jersey where I practice also. So we're confident we can find a practice for you that is convenient to you where you can have this service.
Excellent. And so we're doing this collaboration with Penn Medicine, but just for like complete transparency, you can use this benefit anywhere.
Yes,
you
absolutely.
can use this benefit at at any health system if you are 65 and older and you have Medicare, or you have Medicare Advantage, or if you're disabled and you have Medicare and you're under 65, you can use this medical annual wellness visit benefit anywhere. But we have this particular program, this text and response program with Penn Medicine.
Yes,
so we're
exactly.
very excited to partner with Penn Medicine and see if we can move the needle, because I know, if you do not have your health, your quality of life is just compromised across the board, regardless of your age.
Yes.
And so, the fact that this is completely free, it's something that will allow you to kind of design your health and wellness going forward in a proactive way is incredibly empowering. And so, and I just think people don't know about it.
Yeah,
People
it's true.
don't know, and it can really be a game changer
Yeah.
for people. So I hope folks will take advantage of this opportunity and text to 622-622. Text the word visit, VISIT, to the number 622-622.
That's correct, yes. And as you mentioned, if you have a primary care provider and you're very happy with your provider, we're not asking that you make a switch. If you would like to make a switch to a different provider, we have this available. Or if you haven't seen a doctor or a provider in quite some time, this would be a great opportunity to have that dialogue and engage in that conversation and take control of your health and empower yourself to be a healthier person.
Absolutely. Well, this has been really wonderful, Dr. Tokazewski. Thank you so much for sharing your time and your information, and hopefully we can see some changes.
Yeah, Sarah, thanks so much for having me, and we appreciate the opportunity to spread the word on this visit.
Absolutely.
Yeah, thank you.
Thank you.